Every morning in Shabwa, parents rush their fever-stricken children to the mother and child hospital, a facility struggling alone against a growing wave of deadly diseases. This report has more.
Every day, the Mother and Child Hospital in Shabwa receives dozens of sick children. Many suffer from serious and dangerous childhood diseases. This is happening while the hospital is working under very difficult conditions. From early morning, the hospital corridors are full of parents carrying their exhausted children. The children suffer from high fever and severe infections. Because diseases are spreading fast, the hospital is now working far beyond its capacity. Doctors and nurses are under huge pressure trying to save as many children as possible with limited resources.
We are seeing the spread of some epidemics, such as measles, with total cases reaching nearly 900 hospitalized. About 95% of these cases are among unvaccinated children. Across different districts of the governorate, we suffer from a very limited number of beds, only about 16 beds. Sometimes, we have to put 2 patients in one bed, which negatively affects care. For example, a child with a skin infection might be placed next to another patient with a cough, causing problems for both.
This growing pressure comes at a very critical time. It coincides with the decision of Doctors Without Borders to stop its work at the hospital. The organization was a lifeline for hundreds of families. It provided specialized medical staff and free medicines and treatments. This support helped families who cannot afford medical costs due to the worsening living conditions. After the organization left, a big gap was created in children's health care. Families who depended on free medicine now face painful choices, either by expensive treatment they cannot afford, or watch their children suffer without help.
We receive approximately 100 to 250 cases daily in the emergency departments. The wards are completely full, and we almost run out of beds for admission. Many cases have to be referred elsewhere, without a doubt. The end of support from Doctors Without Borders, who left in December, will create many difficulties, obstacles, and challenges for patients. For us as medical staff, and for the hospital management, there is a general challenge across all medical services. The good news is that we are still fighting and trying to maintain the same quality of care.
As the number of sick children continue to rise, voices are calling for urgent action from the Ministry of Health and local authorities and international organizations. If the Mother and Child Hospital in Shabwa is left without real support, the crisis could turn into a major health disaster. Children, the weakest victims of this ongoing crisis, will pay the highest price.